Hello and a very warm welcome to all our viewers. My name is Lara and we're here at the American Dental Clinic in Dubai. Joining me today is Dr. Urania, the cosmetic dentistry specialist here at the clinic. Hello and a very warm welcome. How are you?
Hello Lara, I'm great. Nice to see you again.
Nice to see you too. It's a pleasure to have you with us on today's show. Dr. Urania, tell us a little bit more about these veneers that everybody's getting done without having to braid their teeth here at the clinic. This is like the newest thing in Dubai.
Exactly. So in the past we used to prepare the teeth in order for them to receive veneers. Now there is a new method where we do not have to remove any of your natural teeth, so you can get the veneers on without any drilling.
Wonderful. And how long does the process take? Let's say I want to get 10 teeth done on the upper, 10 on the lower. How long does the actual process take?
So usually we need 2 appointments to complete 20 teeth. With the first appointment we are going to take an impression of your teeth, and then we are going to fabricate the veneers, and in the next appointment we are going to glue the veneers on your teeth.
And what about the quality of the veneers? How would you compare it to the veneers in the past? Now I have a few cases, friends of mine actually, where we were having like popcorn or nuts or seeds, and I actually saw their teeth being broken in front of me. So how would you compare the quality of the past to these beautiful stick-on veneers?
Yes, actually nowadays we know better. In the past we used to remove a lot of tooth structure to glue the veneers on. That was making the veneers and the tooth weaker. So what we are doing now, because we are not removing your natural tooth, when we glue the veneer on the tooth, the veneer is stronger, so it's harder for the veneer to break.
Wonderful. Now last but not least, what message do you have for the viewers that are watching us regarding veneers? What would you say to them?
So I would like to say that when you're choosing your cosmetic dentist, you should be very careful. You should always check the credentials of the doctor that you're choosing to do your veneers with. You should also ask for before and after pictures so that you can be sure that the doctor is showing you real cases of real patients. You should also be skeptical about the price differences that exist in the market. Having a cheaper price doesn't really mean that you're going to have a good job. I have done a lot of redos for veneers that people did with a cheaper price, but the result was not good. So in general, before you decide where you're going to do your veneers, you should ask some questions and do some research so that you are satisfied with the final product.
Dr. Urania, thank you so much for spending some time with us on today's show. It's been a true pleasure talking to you and wishing you continued growth and success.
Thank you so much, my dear.
Nice
to see you too.
Thank you. Nice to see you too. Unfortunately, that's all we have time for from Dr. Urania. My name is Lara, signing off. Until next time. Hello and welcome back. We're here at the American Dental Clinic and joining me is Roxana Tabrizian, the registered dental hygienist. Hello and a very warm welcome. How are you?
Hello, Lara. I'm good. How are you doing?
Good, good. It's a pleasure to have you with us on today's show, Roxana.
It's always a pleasure to have you here, Lara.
Thank you. We're going to start off today by asking you to tell us a little bit more about what are the key elements or what are the key points one has to look after when trying to achieve a healthy mouth.
Actually, a healthy mouth means a healthy body. And the prevention is the word that we need really to focus on. As a dental hygienist, my goal is to teach my patients how to take care of their mouth in order to have a healthy body as well. So the easiest way is to brush their teeth twice a day with a fluoride toothpaste, and to floss their teeth, to take the plaque and food debris and bacteria from under the gum and in between the teeth, and to see your dentist and dental hygienist every 6 months. And of course, eating healthy is very important as well.
Absolutely. Now, when patients want to buy a toothbrush, what is the toothbrush you would recommend to them to buy?
Actually, I would say electric toothbrush is an excellent choice because it has the timer, and the technique is somehow in it. So even with people that they don't have proper dexterity, they can use the electric toothbrush without being able to move even their hands or their fingers properly. So it brushes equally all your mouth. By having the timer every 30 seconds, you can brush each quadrant in the mouth. The manual toothbrush can be good as well, but you have to have the proper technique, and the time is important as well. You have to be able to make sure that you brush at least 2 minutes your teeth. I would say electric toothbrush is better, but the manual one has to be with the soft bristles though.
No, I do realize the difference myself on a personal level. When I brush my teeth with an electric toothbrush, it's a much more of a smoother finish than with a manual toothbrush. So basically, how many checkups does one need to get a year on their teeth?
Twice a year.
Okay.
It's good for if you don't have any other problems. Twice a year, it's recommended to have your dental checkup as well as your professional cleaning every 6 months.
Okay. Now, as you know, we're all pretty stressed living in the busy, beautiful city that we call Dubai. A lot of us grind at night due to having a lot on our plates. So what would you recommend for patients that have a very, very heavy grinding?
Yes, Lara, grinding is not only the stress. Of course, the stress is a big part of it, but there are many other factors that play an important role in grinding. So what I would recommend is to see the specialist dentist. In our clinic, we have all dentists are specialized for that, and they can help you with either adjusting their bites, giving them a night guard, or other treatments that they are all excellent. Doctors about that. They know how to treat them. I would suggest them to come and see the dentist here.
Okay, wonderful. Dr. Roxana, last but not least, before we say goodbye, what message do you have for the viewers that are watching us right now? What would you say to them? What advice do you have for them with regards to a healthy mouth?
Actually, I would tell them that always remember, a healthy mouth leads to a healthy body. So try to keep your mouth healthy by brushing, flossing, and eating healthy, and come and see us here at American Dental Clinic twice a year.
Roxana, it's been a true pleasure talking to you. Thank you very much for your time and wishing you continued growth and success.
Thank you, Lara.
Thank
Have
you.
a great day.
Thank you. Unfortunately, that's all we have time for from Roxana Tabrizjan. My name is Lara, signing off. Until next time. Bye. And we're back here at the American Dental Clinic, and joining me is Dr. Lynn Kassler, general dentist here at the clinic. Hello and a very warm welcome. How are you?
I'm great. Thank you for being here today with us at the American Dental Clinic.
It's my pleasure to be here. Dr. Kassler, please tell us a little bit more about the International Children's Dental Health Month, which is taking place during the month of February.
Yes, February was designated as the National Children's Dental Health Month, and it was established to help parents realize that children's dental care is important as well. A lot of people feel that the baby teeth don't need to be repaired or fixed because they fall out. So it's to tell them that taking care of a child's teeth also helps take care of their health, because children can have infections in their mouth and their gums can bleed, and so it's really very important. And they can have pain with their teeth as well, as just like an adult. So it's important. So this is the month to gear for parents to realize that, yes, maybe I need to book my child and have them come in for a dental exam and checkup.
Okay, and now moving on to gum disease, which seems to be growing in this part of the world. Tell us a little bit more about that.
Yes, they say that gum disease is actually probably about 35% of the population have gum disease. Once you have gum disease, it can be controlled, but it never goes away. So you constantly will be what we call a perio maintenance patient. So that means you would need to be seen by the hygienist more frequently than just once or twice a year. When you have gum disease, you usually would recommend 3 to 4 cleanings a year, because what happens is the bacteria and the plaque from eating and stuff will harden on the roots of the teeth, and that will cause that the bacteria, it gives it like a ledge to protect it underneath. So with that, that has to be removed by the dental hygienist to get that bacteria away, which the bacteria toxins is what cause the bone to break down. So once you remove that, then you're able to maintain and keep a healthy mouth.
Okay. Now, moving on to fillings. A lot of people in this part of the world are removing their silver and gold fillings and moving to white fillings. Is there a reason for that? Is there a difference in the quality of the filling between white, the silver, and the gold filling?
Yes, gold is the traditional way, and it is one of the best fillings out there, but because it is not cosmetically pleasing, a lot of people are not wanting gold in their mouth nowadays. And the silver is actually held in only by a mechanical retention, so you have to create a wall like this to kind of keep it down in place. And so most people, because it also stains the tooth and will turn it kind of a silver color around the filling, most people nowadays are wanting to go more with a white resin filling. So the silver or the gold, either one, can easily be removed and be replaced with the white or resin filling. So to do that, the resin makes the tooth stronger because it actually interlocks and bonds with the tooth. So it kind of will go in and hold it like that. So it gives both walls on each side more strength. And of course it's cosmetically nice. We can make it match your tooth color exactly. There's lots of shades for different colors of teeth, so it can blend right in and look like there's no filling there at all.
What is the lifespan of a white filling?
White fillings usually last anywhere from 5 to 7 years. We recommend that they be checked, and if they need to, that they be replaced.
Last but not least, what message do you have for viewers that are watching us right now? What would you say to them regarding oral hygiene?
I would just like to say that everybody should come in at least twice a year and see a hygienist and be checked by the dentist. And x-rays are very important so that we can actually see what's going on inside of your teeth, not just visually. So I know here, a lot of people, they don't want to have the radiographs and stuff, but they're very important to have them at least once every 3 years.
Dr. Kasser, thank you so much for spending some time with us on today's show. It's been a true pleasure talking to you and wishing you continued growth and success.
Thank you for having me.
It's a pleasure.
Bye-bye.
Unfortunately, that's all we have time for from Dr. Kasser, Dr. Roxana, as well as Dr. Urania here at the American Dental Clinic. My name is Lara, signing off. Until next time.